Hello everyone, today with you is Dr. Demchenko, and we will talk about how to relieve shoulder pain. If you fell and something cracked, tore, or ruptured, it's best to see a traumatologist, get a magnetic resonance imaging, and possibly have surgery or other treatment. But if you overtrained or your shoulder just hurts on its own, you can try a couple of exercises that often work. Exercise number 1 works well if you have such a set of symptoms. First, it's painful to raise your hand up. Second, it's painful or limited to lift sideways. Third, it's limited to pull back but relatively painless. Moreover, how to understand is your pullback limited or not. Compare with the other hand. If the other hand moves easily but this one is more difficult without severe pain, that's our indicator. And third, it's easier for you to break this hand inward against resistance than this one. With a very high dose and probability, the first exercise will likely help you. For the first exercise, we will need a wardrobe, a pole, or a chest of drawers. For this, stand with your back to it, turn your hand so that the palm is facing the floor. And place it at that level, let's say, of the shelf or chest of drawers, where you can put your hand without pain and without turning to the hand. Next, you need to turn squarely with your back to the cabinet. Your hand should lie deep enough in the shelf. And we start doing squats. Squats are done with a straight, good back. To get a good stretch in the shoulder, do 10 light squats, and after this, be sure to check the symptoms. That is, has it become easier to raise your hand? Have the muscles become stronger? What are the general feelings? If the general feelings have improved, then you can progress. In what way? The first type of progression, you can slightly raise your hand higher and sit down a little stronger. Be sure to move smoothly and not quickly. We are not trying to push anything anywhere. We are trying to stretch the fabric smoothly, softly, rhythmically. After 2 or 3 days of such exercises, if you see that progress has slowed down, you can only intensify on the first day. It is desirable that it takes several days. As an intensification, we can use a delay at the end of the amplitude. That is, you went down and just sat here to stretch the fabric even better. If you felt that after a series of exercises there are some unpleasant lingering sensations, you can also apply ice to the shoulder area for 10 to 15 minutes through the fabric just to slightly soothe the tissues. And this means that you did a bit too many exercises at once and reduce the number of repetitions. Exercise number 2 helps a bit less. And we do it with the following clinical picture. If it's also painful for you to raise your hand up, painful to raise your hand to the side, but at the same time there's no limit to moving it back, and it goes well for you, without pain and high, then you can try to work with internal rotation. This exercise goes well if you can bring the sore arm to the middle of the back, like here. If you can't lift it, then do exercise number 1 until it reaches the middle. You need to take any stick. It should be better a stick than any belt. With a healthy hand, grab the stick from above. With a sick hand, grab the stick from below. Further, we perform a small passive hand pull upwards along the central line. It might be a little painful, but we can consider it a good sign if after 10, 12, 15 repetitions, with each repetition, it becomes a little easier and a little higher to go. Also, a good pain is considered during exercises if it is of such a pulling, weakening character. After a series of exercises, be sure to check the straight lift of the arm, the lateral deviation, and the strength of the external rotation. If all of them improve, then we continue to do exercise number 2 in the same mode as the first one. Exercise number 3. We use exercise number 3. If after exercises number 1 and 2 your characteristics of lifting through the side and external rotation have gotten worse, if they have gotten worse, then we can use the following exercise. You need to put your hand on some high support, or if it's a lower table, you should sit down. Put your hand. And with the other hand, we make such repetitive movements. External rotation. After 10 times, be sure to check how things are going. If things are going well, you can repeat this exercise in the same mode. As a progression. For this exercise, you can also use a higher elbow lift position. That is, for example, if you have some stationary surface, you can sit down and perform the rotation with a higher amplitude, or use a higher support. If you want all these exercises to be as effective as possible, it's very important to perform them at the end of your maximum amplitude of movement. That is, if you can, for example, raise your hand up to here in the exercise, then movements at the average amplitude are unlikely to give very good results. That is, you reach the end of the amplitude and work in it. If we use an exercise with external rotation, then movements here most likely will not give good results. If you have the end of the amplitude here, it would be good to reach it. Because in fact, these exercises are stretching the muscles at the end of the amplitude of movement. If you liked the video and the pain went away, give it a like, leave comments. You were with Dr. Demchenko. Goodbye, everyone.